Hi Terry, this is my oral health promotion fact sheets that I've created for the class. I'm just showing you over video because I won't be able to stay after Friday to show Dawn. This is the front of the binder, then a little title page for the patient to read, and then as we go over here, this is a table of contents with the pages, also the title of the page. It first starts with plaque and calculus. It just describes what plaque is and what calculus is. For the next page that I'm going to show you, it's about gingivitis. It just gives you what it looks like and the contributing factors that can cause this in the mouth. Then next we have periodontitis, which is a couple of pages long. It just basically describes what it is, and then it goes on to the different stages as well as the contributing factors. And then we have the brushing methods, so it goes from Bass method to rolling strokes to Charter's method to Stillman and modified Stillman to the Fawns. So next we have is basic oral self-care. These are all the basic items. And after the page, it just shows the client what you can use for powered devices, as well as devices that you can use by hand. By hand is also a lot larger. It's a couple pages long because there's a lot more that are self-activated by the client. Next, we have cavities. It basically shows the client what they are and where they can form and what you could do to detect it, and then the risk factors. On the back, it's me, just a sample page for me to explain to them while I'm showing them, as well as the process and what they look like. The next is fluoride. It just describes what fluoride does, and it basically just describes the two methods and what they can do in the office as well as at home. The next is tobacco use. It basically describes what tobacco is and what it could do to our mouths if we prolong the smoking. This is my page just to read to the client, just to educate, and on the back is just a page just for prevention. So basically to stop and continue oral self-care and use an examination. The next one is the intraoral examination that the client can do at home once in a while just to check up on things. It's just a picture showing them the steps, and on the back is for me to explain to them. So basically the steps for me to explain to them. The next is xerostomia, dry mouth. It basically shows you what can cause it and what it looks like. Then it's just a page for me to explain what the symptoms are and some of the examples that of health conditions that could come from xerostomia. And then it just shows the sign and the symptoms. And then also it's like describing the treatment of how to not treat it but take care of it while you have it. Then there's eruption stages of the teeth. So the first one I have is primary. The second one is mixed, and then the third one is the permanent dentition, and basically all of them just go through the stages of age and the eruption patterns. Next is healthy living. It's diet and nutrition. I basically explain to the client to eat healthy and to take care of their teeth. So this is a page where I read off of foods that can cause the caries and poor nutrition, as well as what to do to get back on track or to balance. This page continues on to mouth guards, protective face gear. It just basically describes the three types, and then again I explain the facts about it and the steps of what they are and how they're made. Next is whitening. It's in-office bleaching and home bleaching. It's pretty basic, and on the back I'm just going to describe them, all the different types of bleaching and how they're done. Next is sealants. This page basically describes what sealants are and what they're used for. On the back, I just basically educate the client on what they're used for and where they're put in the mouth. Next is about denture care. It basically shows pictures of dentures and what to do to take care of them. On the back, I will explain steps to take care of denture if the client wants to know. And next is basically about dental prosthesis care, so crown, bridges, implants, and basically just put pictures of what they look like and what items you could use to take care of your dental prosthesis, if it's removable or not removable, partial or full. Next is orthodontic care. I basically put pictures of a before and after, so a picture of what braces, healthy tissue looks like with braces, and what braces could do if your mouth isn't taken care of and you're not getting rid of all the plaque. So these are some of the items that the patient could use. Then it goes on to oral hygiene care for an infant and a child. So on both pages I put infant and child. Basically it just goes for infant, you just wipe the mouth. For the child, you have to use a toothbrush and a toothpaste, as well as sealants for preventative use. And at the back here are all my references. One, it goes in order to the page. My references were about 7 pages long, 7 to 8 pages long. And that's it. That's my project for my oral health promotion fact sheets. Thank you.